There's a lot of myths about seeing a psychiatrist and a lot of misinformation about what they actually do. The reality is, though, they're specialists in helping people manage how they feel and what's going on in their head. They work in a range of places like hospitals, medical clinics and community health centres. And for some people, seeing a psychiatrist can be the best way to get help.
Hi, Tim.
Hi, John. How you going?
Good. Nice to meet you.
You too. A lot of young people, John, think that coming to see a psychiatrist is a pretty big deal. Do you mainly see people that are really struggling, or it's a whole range of problems?
Yeah, I see a lot of different people, and I suppose the issues can be quite broad. So some people, they're not having sort of serious problems. They might be having difficulty with their study or with their work, and they can't do their usual things. For example, some people might find it difficult to get out of bed. They worry a lot about their life, about what they should or shouldn't do. They can have problems with their sleeping, with their eating. They're not able to concentrate on things.
Some people think that when they see a psychiatrist, they have to see them forever. Is that true?
No, it's not generally true. Basically, a lot of young people would come and only see a psychiatrist for one session, and that's usually about trying to provide basic information and trying to understand what the problem is, where they can go away and put some of the strategies in place themselves. And other people, I suppose, need to come back for more sessions to gain a better understanding of the problem. And usually that's because the problem might be either more severe or because it's been there for a long time and it can take a little while to kind of improve.
How does a session actually start?
Well, usually they would ring up to make an appointment, or their GP would ring up to make an appointment, and I would encourage people to speak to either the doctor themselves or their secretary to work out what's involved. And usually I start the first session with trying to get an understanding of the problem. So I might ask, what can you tell me about why you're here? And then basically the conversation then flows from that.
So if someone's diagnosed, for example, with depression, do they have that diagnosis forever?
No, they don't. I mean, the vast majority of people recover from their depression. For a lot of people, that's the end of the matter. They don't get depressed again. For some people, though, they do get depressed again. But it's important to note that with the right sort of treatment early on, then the degree of their depression, if it were to recur, would be far less.
So what's the difference between a psychiatrist and a psychologist?
I suppose, broadly speaking, a psychiatrist would see people with more severe problems, and a psychiatrist, being a medical doctor, has the capacity to prescribe medication, but they are also able to do psychotherapy, as I mentioned before, but also suggest simple techniques as well. So there might be a great deal of overlap, but I would strongly suggest that if a young person has a problem, a mental health problem, that they're better off seeing a psychologist or a psychiatrist than not seeing either one.
When someone comes to see you and they're given a diagnosis, what would happen next?
I would recommend, I suppose, a series of strategies to try to overcome depression, and they can range from very simple strategies such as breathing techniques or physical exercise, or relaxation techniques, to then more specific types of interventions such as what's called psychotherapy, which is talking therapy, and that requires a series of regular sessions where the problem is discussed and different ways of how to deal with it. If you've tried a lot of different strategies and nothing seems to have worked, and that's when I would consider medication.
So not everyone has to take medication?
No, they don't. In fact, most people with depression are not required to take medication. It's only really for people who have more serious symptoms and where the depression has been there for a long time.
Some people might think if they go on medication that it's forever. Is that true?
Yeah, that's not the case. The idea is that firstly people need to recover from their problem, and once they've achieved recovery, then the usual recommendation is that they were to take the medication for roughly 6 months, something like that.
How much does it cost to see a psychiatrist?
Well, the cost can vary. I mean, most psychiatrists have the capacity to bulk bill some patients, so that just requires a Medicare card, and you sign a form when you're there. Most psychiatrists probably charge around about $30 out of pocket, so and often that involves coming up with an upfront payment and getting the rest back from Medicare.
Well, thanks, John. Thanks very much for your time today. It's been great.
No problem.
Cheers.